Welcome to Riverside Strong. I'm your host, Cheryl Nelson. On this program, we celebrate health and healthcare as we explore a whole range of medical issues from the perspective of both the patient and the healthcare professionals. We will also learn about the advances in medical technology available through Riverside Health System that have helped so many people get back on their feet and back to enjoying their lives. Riverside Health System is an integrated health network touching 2 million lives annually. Serving Eastern Virginia since 1915, Riverside is guided by a mission to, quote, care for others as we would care for those we love. The health system offers a variety of services and programs in the areas of prevention, primary care, diagnostics, neurosciences, oncology, orthopedics, aging-related services, rehabilitation, medical education, home care, and hospice. With more than 700 physicians and advanced practice providers across a broad spectrum of specialties, Riverside Health System provides services in over 75 locations throughout the region. Riverside Lifelong Health also operates 6 nursing home facilities and 3 vibrant continuing care retirement communities and home health and hospice services. So no matter what type or level of medical care you need, Riverside Health System is here for you. For more information on Riverside, visit riversideonline.com. It's easy to understand why Riverside Health System should be your first choice when looking for the best solutions to any medical issues you may have. And when we come back, we'll get some real-life experiences from both the patients and the professionals who cared for them. Stay tuned.
Choosing a healthcare partner is an important decision. At Riverside, we understand that. We also understand what you want and need. Exceptional care, comprehensive services, access to a network of expertly trained medical providers, specialists, and care teams when and where you need it. And most importantly, a team dedicated to partnering with you throughout your journey of lifelong health and wellness. We say partner because at Riverside, we are healthier together.
Welcome back to Riverside Strong. Today's episode is dedicated to women's health. Women's health can be pretty complicated, and waiting for results from mammograms and yearly screenings can be very stressful. So what happens if your fears are realized when you finally get the results?
My family's been blessed. Nobody's ever had cancer. I'm an artist. I love to draw, and I'm also an author. I'm in the process of trying to get my first novel published. In August of 2020, last year, I noticed that I had some vaginal spotting. I really just thought maybe I had scratched myself or something. I didn't really take it serious. Then I started to notice I was bleeding. It was more than just spotting. So I went to see Dr. Hankey, and he ordered the vaginal ultrasound test and saw something, and he talked to me, and he said that something was growing that shouldn't be growing, and that he wanted to do a biopsy. So he scheduled the biopsy, which was done March the 5th. And by March the 16th, I got a call from him that I did have endometrial cancer.
Endometrial cancer is a common cancer in the United States. It is the 4th most common female cancer in the United States after breast, lung, and colorectal. Uterine is the 4th. There were roughly 67,000 women diagnosed with endometrial cancer in the United States last year, and roughly 12,500 women died from that malignancy last year. 90 to 95% of women that present with endometrial cancer will present with some form of bleeding irregularity. They present with changes in their bleeding patterns. So the bleeding gets heavier, they start to bleed more irregularly, things of that nature. So endometrial cancer is one of the few cancers that becomes symptomatic almost immediately with its onset. Women come in and have that evaluated, and 75% of the time, with that early presentation and diagnosis, the disease will be confined to the uterus, and they will have a very, very high rate of cure. So Ms. DeHart was a lovely woman. She's 63 years of age. She had presented to a primary care physician with complaints of postmenopausal spotting. She'd had a 5-month history of postmenopausal spotting, and she came to see her primary care doctor, who subsequently referred her to a gynecologist here at Riverside Regional Medical Center. He recognized that as a worrisome finding for the possibility of cancer. And the final pathology report from her DNC did demonstrate the presence of a grade 1 endometrial cancer. So she did have endometrial cancer. She was then referred to me by the gynecologist.
I can remember driving up to the cancer center over in Newport News by the big Riverside Hospital and just thinking, I'm going to a cancer center. Dr. Irvin is great. He walked in there, he was very encouraging, very, thorough. He took as much time as I needed to explain everything to me and said that the best thing for me would be to have a total hysterectomy.
She did well with her surgery and was found to have a very early stage endometrial cancer, what we call a stage 1A endometrial cancer. So with robotics, we make tiny little incisions on the abdominal wall. We put trocars through those incisions, which are little hollow metal tubes. We insert instruments through those trocars, and those instruments are then attached to this incredibly complex computerized platform called the Da Vinci robot. And then once we have all that set up, I leave the patient and walk 20 feet away and sit at a console in the corner of the room, look through a little eyepiece, and I'm looking into the patient's abdomen, because one of the instruments we put into the abdomen is a camera. It's a video camera. And through that camera, sitting at the console, I can see all of the patient's organs and insides, and I control the surgical instrumentation from that console. And the advantages to the robot are, number one, you don't have the big incision, so they get better so much faster. I think Julie was very typical of women that present with endometrial cancer. She was Caucasian. She was 63 years of age. She had diabetes. She had hypertension. She presented with a 5-month history of postmenopausal bleeding. She was found to have early stage disease because she followed up on that bleeding relatively quickly, was seen and evaluated, and she has a wonderful prognosis. She should be cured.
He told me, he said, you only got a 2% chance of it coming back. He said, so I feel like you're cured.
What a great ending to Julie's story. While not every cancer story will have the same results, it is comforting to know that if you are diagnosed with gynecological cancer, the expert team at Riverside Cancer Center can provide the best care to help you along your journey. Coming up, we will continue our dive into women's health with a beautiful story about life.
We're Riverside Strong. At Riverside, we are here to keep you healthy and safe. We are here for you. For annual wellness visits, managing health conditions, or if you experience new health-related issues, difficulty breathing, memory loss, or symptoms you can't explain. Make your appointment today in our facilities or online. We are here when and where you need us, so don't delay your care, your health, or your wellness. Call or visit Riverside online to make your medical appointments today.
One of the most common diseases that we treat as neurosurgeons is pain in the low back. It's a complex disease that affects almost 80% of Americans at some point in their life. A lot of people are intimidated when they come into our office to see a neurosurgeon. They're often here to talk about spine surgery and brain surgery, which can be life-changing. One thing that people really don't know about brain surgery is how easy and quick the recovery is. I'm Dr. John Lamb. I'm one of the neurosurgeons with Riverside, Hampton Roads, neurosurgical and spine specialist.
Welcome back to Riverside Strong. When you think about women's health, it's hard not to think about babies. But unfortunately, many women struggle with becoming pregnant or with the pregnancy itself. So what happens if there are issues during the delivery or with the new baby? That's what this next story is all about.
Riverside Regional Medical Center is the only hospital on the peninsula offering a level 3 NICU. We have 24/7 provider coverage from a neonatology team, and then specially trained nurses who are able to care for our babies who are very small or needing extra assistance. Our NICU team here at Riverside works with our parents to collaborate and come up with care plans together. We want to help them reach their goals. We let parents help set goals for babies.
We had been trying to have a baby for almost 13 years. We had lost 2 children with adoption that didn't choose us. When you lose a baby and then you lose a baby in adoption, it's not physically the same, but emotionally it's the same. We thought we had a whole nother journey instead of me possibly being pregnant. I took a test. I took 10 tests. And finally, the 10th one, I said, "We're having a baby." I had a scan done, and they noticed that the cord blood was sluggish in one cord, but the other cord was flowing fine and regular, but we still had to be very cautious. And from that moment on, Dr. King was on it.
My name is Joseph King, and I'm currently a practicing OBGYN for Riverside, and I've been here for 15 years. I also currently serve as the president of the medical staff at Riverside Regional Medical Center. Courtney's case is special to me because of who she is and the relationship that we had. I know that she had multiple pregnancy losses before the birth of baby Isaac. And so I knew very well that this was something that she and her husband really, really wanted. I'm a practicing obstetrician. I don't per se work in the NICU. However, we work almost seamlessly. We work hand in hand. I can't count the number of instances where I have actually needed their services to come and take care of premature infants or infants who are having compromise during the course of labor. And you walk into that room, you hear that fetal heart rate on the monitor. You know, you can't see it, you can't see the baby yet, you know it's in there, but you hear that heartbeat. And oftentimes moms are looking at you for leadership and guidance as to how to get through this kind of thing. It's inexplicable how this process goes and the transformation that you see your patients go through from the time they're in office and then the superwomen that they become in labor. We're focused on baby, we're focused on mom, and we're kind of just trying to figure out what is the best way to achieve this delivery. So we work hand in hand on a daily basis, and I think we do a very good job of working together as a team in terms of trying to make this kind of thing happen. There can be some early warning signs that a mother is in danger of going into preterm labor. The number one risk factor is going to be having had a history of preterm labor. There's also some signs in terms of when we do early ultrasounds, we can notice that the cervix does begin to shorten and not be as long as we would like for it to be. There's also issues as to women persistently come in with contractions and complaints even though their cervix isn't changing. Just we can see that uterine activity, and we know that with that uterine activity there can be some cervical change and there could be a possibility of some early onset labor. The vast majority are born vaginally because it's a preterm labor process that starts that we can't stop. Those are oftentimes going to be by cesarean section because if there's risk factors, then there's conceivably an issue with the baby tolerating labor, which is of course the most stressful time for mom and baby. Here at Riverside, this is something that we manage on a daily basis.
It was kind of like if you feel like time stands still and you're standing there and there's all this stuff going around you, but you're still like you can't move. So Dr. King comes over and he's like, "Look, this is critical, but this is critically controlled. This is good. You're gonna meet your son today. This is gonna be a good day. This is gonna be a great day to have a baby." I told Dr. King, I said, "Dr. King, I just need to hear him cry. That's it." And he said, "You're going to. I got this." He did not even have Isaac out, and Isaac was screaming. And the nurse, Kathy Majette, I'll never forget, she said, "He's got good lungs and he's peeing. We're good. This baby's gonna be fine." But at that moment, I knew he's better out than in, and he's going to one of the best places he could be.
in this area, if you're going to be looking for a level 3 neonatal intensive care unit, we're the only show in town. And not only because we're the only show in town do I think we should be the place that folks deliver, but we also do a very good job.
And it's more than just having your baby in the NICU, it's a family. The NICU's a family. The nurses care about you not just while you're there, but they care about your journey home, and they care about how he grows up and how she grows up. And even to this day, I know, and my husband knows for a fact, had it not been for the urgency of Dr. King and his team, I wouldn't be here. And if it hadn't been for the care and the support of the NICU doctors, nurses, and that team, Isaac wouldn't either.
What a wonderful story. Dr. King and the NICU team at Riverside Regional Medical Center really helped Courtney's dream of having a family come true. If you are looking to start a family, make sure to call Riverside. We will take a look at a different side of women's health, the brain, when we return, so make sure to stick around.
We're Riverside Strong. At Riverside, we are here to keep you healthy and safe. We are here for you, for annual wellness visits, managing health conditions, or if you experience new health-related issues, difficulty breathing, memory loss, or symptoms you can't explain. Make your appointment today in our facilities or online. We are here when and where you need us, so don't delay your care, your health, or your wellness. Call or visit Riverside online to make your medical appointments today.
Welcome back to Riverside Strong. As we continue to explore women's health, we will see how sometimes being young and active doesn't always guarantee health. And while some health issues have obvious warning signs, others can strike in an instant and change your life forever.
It was a normal day. I got up, went to school. In the mornings, we have second grade, first grade, and then kindergarten. So I taught second grade, taught first grade, and everything seemed pretty normal. And before kindergarten, I had to go to the restroom. So I went, and all of a sudden, my head just started pounding, and probably the worst headache of my life. And the next thing you know, I guess I blacked out for a second, and I was on the floor. And my back against the stall, and I'm just confused. I'm like, okay, let me call someone. So I used my Apple Watch, and next thing you know, I'm in the ambulance. The emergency room visit was a blur. And the next thing you know, boom, boom, boom. And they immediately rushed me into surgery.
She was 26 years old when it happened. No warning, out of the blue. And people often wonder, young people and stroke, we've never heard of that before. Is it possible? And the answer is yes. Stroke does not discriminate. You can be a young person, and in Christina's case, it was a different reason for stroke. She had an aneurysm that she wasn't aware of. And that can happen at any age. But ischemic strokes are being noticed in younger and younger people, not because something's different about them. In many cases lately, it's because they're accumulating risk factors at a much younger age. The common risk factors are hypertension, diabetes, high cholesterol, obesity, smoking, sedentary lifestyle, and sleep apnea. These are some of the common ones, and many of these things can be controlled so that you can eliminate the risk of a stroke. And as time keeps going from when they had the problem start to when they can actually receive the treatment, the amount of viable brain is less and less each minute. This loss of neurons is irreversible, so going to the highest level center is imperative right away. Neurology as a field is incredibly attractive because that is one of the frontiers of where clinical development and research is happening. Every day we're learning something new about the brain and the incredible ways in which we can treat diseases that were not possible in the past. And one of the key areas where this has been happening in some spectacular ways is stroke. And it's really important to recognize that if you had a stroke once, you can have a stroke again. Within the same year, that risk is 1 in 4. 25% chance of somebody having a stroke in the same year. That is incredible. So it behooves one to do everything in their power to do all things better than they used to do to minimize that risk. It's very important to recognize the signs and symptoms of stroke. There are many, but one good way to remember the common symptoms would be to use the mnemonic B FAST. Each letter stands for a symptom or a call to action. So the letter B stands for balance. So if you have poor balance that starts suddenly, that could be a sign of stroke. E stands for eye-related symptoms. F stands for face. So if you have a droopy face. A stands for arm. If your arm starts to droop, that might be a sign of stroke. It's not just limited to arm, it could also be the leg. S stands for speech, any aspect of speech being impaired. T stands for time to call 911. Someone coming in with a condition like this, you can mistake it for somebody just having passed out and waking up with a headache and not taking it seriously enough to seek immediate medical attention. And in Christina's case, that would have been devastating for her. Strokes need immediate treatment, and be they strokes that are resulting in low-level disability or high-level disability, they all need medication treatment. Riverside Regional Medical Center is a comprehensive stroke center. That means that Riverside has made a commitment to keep Riverside as a center of excellence in delivering the highest level of stroke care. We have 24/7 acute stroke treatment teams, right from the emergency room doctors to radiologists who give us the information from emergency imaging studies to intensive care unit management, where people need multidisciplinary teams consisting of different specialists to take care of the patients.
The next thing I do remember is waking up in the hospital room, confused, looking around like, what just happened? And then Dr. Ramakrishnan was there to explain it to me. She's awesome. And Dr. Ramakrishnan, she explained to me after I woke up and things from surgery that I had a subarachnoid hemorrhage, which is a ruptured brain aneurysm, and that it's considered a stroke. And she told me, exactly what happened and what they did, the surgery and things. And I was just still a little confused because I'd never heard of it before. I don't even think I've heard of an aneurysm before that. And I just was a little uneasy, but each day got better when they started explaining more and more about it. I wish more people knew more about the subarachnoid hemorrhage or brain aneurysm in general, because I know for me, I hadn't heard of it and I didn't know what was going on. I didn't know any of the signs. I didn't really know the signs of stroke because I'm 27. I didn't think much of it then. And I feel like more people, even my age, should know the signs of a stroke and also the signs of a ruptured aneurysm.
It's incredible how fast Dr. Ramakrishnan and the neurology team at Riverside Neurological and Spine Institute were able to attend to Christina and save her from the long-term effects of stroke resulting from a ruptured aneurysm. We've learned so much today about women's health and how different issues can affect women from all walks of life. Our health is precious and we have to take care of it. But when problems do arise, it's great to know that Riverside Health System is on your side. So until next time, stay healthy and stay informed with Riverside Strong.